Hi, I'm McKenna. I am going to be demonstrating how to insert an IV today. So the first things you'd want to do is check for allergies to any cleaning solution that you're going to use, iodine. Make sure you have an order for the IV insertion so you're not just poking them for no reason. And make sure that you're documenting once you're all done, but I'll get to that. So let's go see the patient. Provide for privacy. Hi Tressie, I'm McKenna. I'm going to be your student nurse today. How are you?
Good.
Can I get your full name and date of birth?
Tressie Hansen, 3/27/74.
Perfect. Do you have any allergies that you're aware of to any iodine or any cleaning solution?
No.
No? Okay, I'm just going to wash my hands here. So I'm here because the doctor did put an order in to insert an IV so you can get your dose of antibiotics. Does that sound okay?
Yes.
And you fully understand why we need to do that?
Yes.
Okay. Are you able to keep your arm still, or do you think I need to get assistance?
Nope, I can keep it still.
Okay. And are you comfortable with it lying down flat, or would you like to sit up?
I'll lay down, please.
Okay, perfect. So I washed my hands. I'm just going to get my supplies ready. I have the bed at a working height, and it looks like there's already a drape down, so that is good. So in case you have a spill or anything. My supplies include a saline lock, a flush, and my needle, and my dressing. So I'm just gonna get my tape ready here. Typically 2 pieces of tape is sufficient enough. I am going to just put the tourniquet under the arm. So can I have you lift your arm for me? Perfect, thank you. Okay, so I have that in place. I'm just inspecting the skin to see maybe if there's a good spot I can just see without doing anything. You could have the patient pump up their hand in a fist a few times, or you could apply a warm compress as well for 10 to 15 minutes if you have trouble finding the vein. So I'm just going to wash my hands again. I am going to remove the air from the saline flush. Since it's sterile, I'm going to take the cap off and be sure I don't touch the tip of the sterile. And I'm going to pull back a little bit so I don't squirt everybody. And just remove the air. And it looks like we're good there. So I'm going to apply that again without touching it. So this is my saline lock. I'm pretending I just got it out of a sterile package, so this is all completely sterile. So without touching the end of the, I can't think of the name of it right now, but without touching the end, you're going to take the cap off the saline again. And you're just going to attach this to the end here and screw it on. I'm just going to slightly, without touching or contaminating anything, I'm just going to unscrew this a little bit so it's easier to come off. I am going to unclamp it because it looks like it's clamped. And I'm going to flush all of the air out and then make sure that I'm getting liquid dripping into the garbage, which we are. So we're good. I'm just going to set this right here so it's ready when I need it. Okay, washing hands again. I'm gonna put on a pair of gloves. How you doing? You doing okay?
I'm fine.
All right. So, now I got this all done. I'm just gonna open up my package here. So that's ready. Just a transparent dressing, and I'm going to apply the tourniquet now, and I'm going to apply it about 10 to 20 centimeters above the insertion site. I don't want to leave this on for more than 2 minutes because you can cut off blood flow, and that is not what we want. We want blood flow. You can also check for a pulse to make sure it's not too tight. And I am just going to gently palpate. Can I have you squeeze your hand a few times?
Okay.
Thank you. So it looks like I found a pretty good vein right here. So I'm just going to take an alcohol swab. I'm going to clean in a circular motion for whatever time your facility has you do that, cleaning from the inside out. and I am going to allow that to dry. I'm not going to swat at it, blow at it, usually 10 to 15 seconds, and it's pretty dry. So now what I am going to do is I am going to remove the cap from my needle. I'm just going to set that to the side. I am going to insert at 10 to 30 degrees angle. I'm going to pull the skin taut with my non-dominant hand, and I want to make sure I'm inserting distally to the joints here, so, and with the bevel up. So I'm going to get ready for a poke. You might feel a little sharpness, but it'll go away until I get blood return. And it looks like I am. So I am just going to gently push the catheter in and withdraw my needle. In a clinical setting, you would release the safety once you get the catheter all the way in, but for practice purposes, I'm just going to set this to the side because I need it again. I am going to release the, oh my goodness, tourniquet. I am going to not take my hand off of the catheter because I do not want to dislodge it and move it. You want it to be secure. I'm just going to take a piece of tape then, put a piece of tape down, so now I can indeed take my hand off. I can flush to make sure that I am in a vein and that I'm not meeting any resistance. And it looks like I am not, so I'm just going to continue to flush. All right, I'm gonna clamp this. Unscrew it, get rid of it. I'm just gonna take this and tape it so it's not in the way. I am going, if there was any blood spill or anything, I would clean this up before I put my dressing, but it looks like I did a pretty good job. So I'm gonna remove the dressing using the no-touch method, so you don't want to touch anything. And I am going to secure the catheter down. And I don't want to cover the entire thing, but I just want to protect the insertion site and make sure the needle isn't moving around. And then I am going to take this all off. All right, so there is an extra little piece of tape on here. I'm gonna initial date and the type of gauge I used. You can do a time too, and I like to put that right there. Okay, so it looks like we're all good. I'm gonna take my gloves off, wash my hands. I am going to put the bed at the lowest position. I would give the patient the call lights, make sure that they are okay and they're not in any pain. Just make sure they're safe. Documentation, I would document the time, the date, site insertion site, like where I inserted the IV, the amount of saline flushes I used, and the gauge as well. So, and then that's how I would do it and how the patient tolerated it.